TCS has the first software organization to fully embrace the case management adherence guidelines and take those guidelines and embed them into a safe case management software program. That is right in and of itself, right there, probably a huge factor that advances our practice of case management and provides case managers opportunities to document the difference that we do. But that wasn't quite enough. TCS said, you know what, we believe case managers need software to support the work that they do. Now, they already had an enterprise software platform that they offered to individuals, but we said we have case managers in small 1 or 2 or 3 case managers that need a software that will work for them, and TCS said, you know, we'll work with you, and they've done that. The Acuity Anywhere product is exclusive for CMSA members, and once again, it's just like that in and of itself would be enough to just get our undying gratitude. Oh, but that's not enough. No, it's not. TCS commissioned one of the first ever case and care management software and technology surveys and full in-depth studies of how case and care management professionals use software and technology in their daily work. And at the end of the day, one of our great partners in advancing the practice of case management is TCS. And so on behalf of CMSA, thank you.
Practice of case management, there is a practice and an art that gives the better outcome, and it needs to be systematized. And what better way to do that? Through procedure manuals, or through instruction, or through training, or through software. And software is a tremendous foundation for providing workflow discipline in any situation. So the practice of case management without a structured environment is just prone to be error-ridden.
You know, my experience in healthcare applications go way back into the early 70s. And it's always been fascinating to me how through a series of 30 years and development of systems to meet specific needs in healthcare, how we're still pretty much at the same point that we were when I started. You know, we're still dysfunctional, we're fragmented, systems don't talk to each other, and all of that has to change.
Our software is unique because it's evolved over 20 years of really working at the infancy of managed care through utilization management and understanding what the principles were in cost containment, and then expanding that to catastrophic and high dollar episodes of case management. And the application itself has developed over a period of time through input from users. The primary source of all that we've gained and understood in the history of our company has been user-driven.
Because the system is so automated and able to be configured by the client, we try to work with them so that they take their workflows as the way they would really want them to work, and figure out ways that throughout the workflow process things are automated so nurses don't forget to do something, so they don't have to take the extra time and effort to do mundane, routine things. And we make that an automated process as much as we can. What that does then is to help increase the efficiency of the work staff, increase their productivity, and it lets them focus on things that are really clinically important rather than all the mundane, routine documentation that goes on. And you also don't forget things. You don't get letters forgotten, you don't get referrals that are forgotten.
That we have always focused on our employees, and that they were going to be the most important part of our business. And I believe if you follow these principles, that people are very important, the people that you work for, you treat them right, everything else just kind of falls into place. Isn't that true?
Yeah, when you put people first, I mean, the results show.